Hello, welcome to another edition of A Lot of Help with JamesLott Jr. I am JamesLott Jr. I'm bringing back a returning guest, also a returning champ, like it's a game show. Returning guest, and my friend, who is a board-certified plastic surgeon, and he has a practicing in Sherman Oaks. But he also, since I talked to him last, has a podcast, Below the Surface with Dr. Elliot Hirsch. So I'm like, it's great. He's sitting in my territory now, but I'm very happy to have my friend, Dr. Elliot Hirsch. Hi, Doctor. Hello, Elliot.
How's it going?
It's good, good. We were talking before we came on, because people always were asking me, well, plastic surgery, obviously that's not, most of it is, they claim it's not really essential, right? It's kind of elective, but isn't it essential? Like, I mean, what is the whole deal with that, first of all, when it comes to plastic surgery?
Well, the difference between essential surgery and non-essential surgery, when you think of essential, you think like it has to happen right now. It's immediate, it's life-saving, it's limb-saving. And so if you've got something that's not like that, then that would be considered non-essential. So a lot of the stuff we do, with the exception of maybe a skin cancer surgery or a breast reconstruction surgery, most of what we do is considered to be elective, which is not essential. So things, when the shutdown first started, everything kind of got pushed back a few weeks.
I was gonna say, but there are times when it is essential. I mean, you can do work that, I mean, like, seriously, like this needs to be done.
Yeah.
This, and so it's not just all elective, right?
No, I mean, like if it tends to be more trauma or cancer related. So if patients have like a melanoma, that's got to get done. Breast reconstruction surgery. If they have facial fractures, hand trauma, that kind of stuff.
Yeah. Oh yeah, I about that. Yeah. So we talked about this, as you know, we're talking before camera too, that things shut down in LA and all. I mean, really pretty fast. I would say within 3 or 4 days, and again, we didn't know. People almost forget in the beginning. I had a trip to go to, and I said, oh, well, I'll fly up there in a couple of weeks. I mean, I had a trip planned like March 29th. And okay, well, I'll be home.
Were you like a vacation trip or what kind of trip?
No, it was my granddaughter's birthday. Couldn't
Nice.
come up because they canceled everything that weekend.
Yeah.
And I was able to actually rebook at the time for 2 weeks from then. I said, well, I'll come in 2 weeks. I couldn't go the following because I had TV shows and that kind of stuff.
Yeah. So
we just thought, well, we will just see. In 2 weeks, I'll be up there. We'll celebrate. We'll celebrate your birthday. It'll be fine. And it just never happened. I'm still sitting here going, well, another grandson had his birthday. I had my birthday. Like everybody had birthdays. Like, so, but I'm saying in the beginning, you have a business. You're thinking, we don't know what's going to happen. This could be temporary or this could be long term. You have no idea. You have a staff. You have a staff and everything. So in the beginning, how was it for you guys? And you're just like, okay, what do we do?
Well, that was my first week was what do I do? Didn't get a lot of guidance, from the city. Was just kind of everything you have to shut down, but it wasn't a lot you could really know what to do with the staff. What we told our staff was, we kind of looked at our finances. Everybody's situation is a little different, but fortunately we had a really busy first quarter of the year. And so we told our staff, we said, look, we don't want anybody going home and being furloughed or laid off. We want to keep our momentum going. And so we're going to keep everybody on staff.
Oh, good. Okay.
So nobody got laid off, nobody got furloughed. Good. And we just said that it's going to be, a couple weeks and you might not be that busy because I'm not really operating, but we just pushed surgeries back 2 weeks. Okay. So for the patients, I think they understood for the most part that we were just kind of working with what we had. But finally, when we got to that point about 3 weeks ago or 2.5 weeks ago now, where we were able to operate again, then my schedule was completely booked because we just had invested in maintaining operations.
What are some of the things you guys have put in place that might be slightly different? I mean, I've been to this office. It's very clean, very sterile and stuff. But what did you guys do that was slightly different than before?
Well, we're doing a lot of telemedicine.
Oh, okay. Explain that to people who don't know what that is.
So it's just like our conversation right now, except I would say at some point, James, let me take a look at your breasts so I can, measure them and plan for surgery.
Yeah. Right. Okay. I mean, lift it up there and I can show you. But yeah, but it's online, which you could actually.
Online.
Okay. Very good.
And so it's the same thing, you got to fill out the packet ahead of time. We talk about different surgical options. We plan, I examine as best I can through the computer, and you kind of plan for surgery that way. So that's one thing, kind of the biggest change. And to be honest with you, I think that's probably going to stay.
Okay. Okay. A great use of technology. In LA, no one likes to drive nowhere. So
for sure.
For sure. It's kind of a great way to do that too. Say, okay, easy for you guys. It's a really great thing, actually.
I mean, it's simple. And to be honest with you, the first part of the surgical consult It's just kind of getting the feel for the doctor and me getting a feel for them as a patient. And, it's totally fine to do that remotely. And we talk, and then if they move forward with surgery, they come in and we do a pre-op visit in person and stuff. That's probably the most significant change.
Yeah,
but we've limited the amount of people who are coming into office at any one time. It's shorter.
But you didn't have a lot of people coming in at one time, did you anyway? Not really. Your office is kind of small. I mean,
it's not huge, but we'd have I would have 1 or 2 patients, and then my esthetician would be seeing a patient, and then the nurse or the PA would be doing an injectable or laser treatment on somebody. And then maybe you got one person in the waiting room, so you could potentially have 5 or 6 patients at a time.
That's true. Plus staff.
Plus the staff. Yeah.
That makes sense. That makes sense. Yeah, because I know that's for a lot of people, that's the scary part. So once you got the go ahead to kind of come back, I mean, so it was, so at this, your biggest thing was scheduling. That was your biggest thing, was like, okay, we got to pick up where we leave off.
Yeah.
Somehow, did you have surgeries also scheduled in June and August? I mean, is everybody pushed back, or how did that go for you?
Well, we had for the first, when when the whole thing started, they said April 15th. That's going to be your remember? And then very shortly they said it's not going to be April 15th, it's going to be May 15th. Yeah. So initially when it started, we had pushed everything back to April 15th. And then when they announced that it was going to be May 15th, we, that to me, that seemed a bit much. And so we pushed people back to May 1st. And then they actually announced you could do elective non-essential surgeries earlier than May 15th. And so once that day was, once they announced it, we already had cases booked.
Okay. That's interesting. I don't get written. It was like, then I heard something maybe May 30th, and they were like, like, how do you plan for that? Like, how do you plan?
It wasn't easy, man. There's a lot of juggling, a lot of adjustments, and thankfully the patients were pretty understanding.
Yeah, I think it's one of those times where you may agree with this, where we're all going through it. I mean, it's not like you're doing this to hurt anybody. Like, you're not. No. Like, seriously, we're all going through it. So the understanding must be a lot easier. This must be a lot easier.
Yeah. Well, we want to be operating, and the patients want to be operated on, but it just has to be done safely. And so, things like COVID testing. Now, anybody gets surgery, I get tested. I get tested once in a while. You're not allowed to bring anybody into the hospital with you. Surgery centers, you can't bring anybody in there. So we're doing lots of little things like that to try to minimize risk.
Yeah. Now you have also worked now you're in the podcasting world. So tell us about Below the Surface with Dr. Elliot Hirsch. Tell us about it.
So we've been playing this for a while, and it was just a matter of having the time to actually start doing it. But it's just a way for me to kind of interact with different people and to get a little bit more of the things that we want to talk about, because not everything that we want to talk about makes it onto something with you or on the news or something we do. It's just a way to get all of the different things that we want out there, reach a wider audience with them.
Well, I mean, I've known you several years now and everything, and you've been on my show many. I mean, I'm a fan of yours, that, and you're good. And I see you on TV. I see you in the morning sometimes. Like, oh yeah, I know him on Channel 5 or whatever. Do you like this? Do you like this stuff? Do you like being on camera and everything?
Yeah, I grew up with my dad was a TV cameraman. And so
I never knew that. I never knew that.
It's LA, of course, right?
Yeah, that's true. That's true. Oh, how fun. Okay.
Yeah. But I mean, like my earliest thing on TV was, I think he was filming a hard copy, and I was gripping for him, and needed somebody to play the role of a guy drinking a 40 on the curb. And so
you did that?
Yeah, I did that. Yeah, I don't think it was like from neck down, but that was probably my earliest TV thing.
Elliot, you're now really my best friend. You couldn't even tell me that. I love this.
Yeah. But it wasn't like, I never had the urge to go into that line of work, and I never wanted to do that. I think my dad made sure that wasn't going to be, the path. Gripping was going to be hauling their not good.
Yeah.
But I never want to do it. But the sense of media is different. I think news is good. You reach a wider audience. You kind of get the message out there. And there's a lot of information out there that I think is not good right now. And so that's kind of I'm trying to be more of a reliable source of information. And as we move on, we've branched beyond just medical topics. We talk about other things too. But like we talked about the restaurant industry, the automotive industry, but just another reliable source of information.
Yeah. So how's it? Because so I have to ask you, how's it been for you preparing for you to go and all that stuff? You see what I do now, kind of, don't you?
Yeah.
I mean, all the things you have to do. It's interesting.
Yeah, it kind of gives you a different perspective, and I know how hard it is now.
It's going to make you a better interview too. It's funny because now I'm getting interviewed as
Yeah.
a kind of personality or whatever. And I walk in, I go, I just sit down and relax and let them do all the work. I don't worry about the lights or the time period or anything. I just come in and I just talk. Yeah. So now you know what it's like. I love that. I know what it's like. How many episodes have you done so far? Do you know?
I want to say somewhere between 10 and 15.
Yeah, I know I've seen it out there. I mean, I always like it, so that's good. And so, did you? Is it like a once a week series?
Yeah. Well, once a week. Most of the stuff right now, it's very topical, and we're looking at the different industries that are affected by the coronavirus. And like we did one recently with the CEO, 800 Degrees Wood Fired Kitchens.
Oh yeah, I know them. Yes.
Yeah, great pizza. I've had that stuff many times. We interviewed the chef Anthony Karen and the CEO Tommy Lee, and talked about how the coronavirus epidemic is affecting the restaurant industry. And for me, it was a very eye-opening thing. I mean, I learned a lot from that.
Wow, as we say in business, that's a good get. That's a good get. Okay, the CEO of them place. Okay.
Yeah, we learned a lot though. I mean, the restaurant industry is. I mean, they're getting clobbered right now, and it's a tough.
Oh, no, I know. This thing affects so many industries. Like it's like Hollywood. Yeah, I get it. But like the other ones to me that are even more essential, like food and clothing, and hair and all this. It's like wow, it's crazy. Like it really affects everything.
It's everything. Yeah.
I took everything for granted. Elliot, I took everything for granted until now. I was literally living in a bubble. Apparently, I didn't even pay attention. Like I miss going to a restaurant. Sitting down, just talking to somebody.
Well, it makes you think twice about. I mean, when's the last time you actually shook somebody's hand?
That's the next thing. And are we going back to that again? Can we do that? I mean, isn't that crazy? I know.
You like what?
I always on the elbow thing now. I was telling people the one thing that I think it really highlighted, and maybe you feel this, you agree too, people's hygiene habits, and also how dirty they are. Right. This is real life, folks. People are calling him. It's real life. He's busy.
It's been deleted.
Oh well, whoever you were calling again. No, but I think it's highlighted how people keep homes, how the buses are run, how the trains are clean or not, how plain. It's really showcasing how. And because you're in the medical profession, I used to be a nurse. We know how dirty the world is.
Yeah.
Now the world knows how dirty the world is, right?
Oh yeah. Yep. It's one thing when you see like you're talking to somebody and you see them and they're picking their nose, and then sometimes they're scratching their teeth, and then they reach out to shake your hand. You're like, but when you see that, on the subway now, there's thousands of people in New York who are riding the subway, and they're doing that stuff, and it's spraying disease. I think the whole world hopefully will have a better understanding of that, and maybe a little bit less, a little less picking and scratching and stuff.
I agree. I just think it really. I talk about really showcasing like how people keep homes, how to keep cars. I mean, it's just highlighted all that.
Oh, for sure. Just the little hygiene, personal hygiene.
And also, I've had people on my show in the last couple of months that were dentists and doctors, and how they've had to change their office practices. Not saying they were dirty, but just like this, how they really had to look at more sanitation ways. And it's very interesting how that was. That's the one thing I think is kind of positive in a crazy way, that
more sanitation.
Everybody knows. It's like we gotta be a little more cautious. And I still wash my hands like a nurse. I was a nurse for like 10 years, and I remember some people say, I know how to wash my hands. I've been washing them. I have plenty of lotionary wear. I mean, I'm not worried about that. I mean, I know how to do that. So I'm like, I've always washed them that way. So I don't mean that. So now everybody's kind of. And I also find people know how to wash their hands properly. People didn't know how to wash their hands properly.
No. Well, I remember in surgical washing is totally different. Yes. And I remember one rotation I did when I was a resident. It was a neurosurgery rotation, and the doctor that we were working under, he was famous for timing us washing our hands.
Oh wow!
So he would watch you, like he would go outside the room, he'd wash his hands for 10 minutes, then he'd come back in, and he'd look at the clock, and he would know if you've been out there for 10 minutes washing your hands.
It's so funny. Yeah, no, it's true. Well, for surgical, of course, you're reaching into, they're susceptible to everything. That's why I was telling my mom was like, I'm not sure I want to go to the dentist. I said, well, make sure they have air because your mouth is open. So make sure that everything is taken care of, that they're taking precautions. I mean,
it's tough,
when a body's opened up, they're susceptible to anything. I mean, no matter how healthy you are. That's
no matter what's going on.
Yeah, what's going on. Well, thank you. I know you're a busy guy, and anytime I get a chance to talk to you is always a great time. You know that.
Yeah. It's good talking to you too. Maybe we could get you onto my podcast.
I'd love to. Please ask me anytime. I'd love to come on. I'd love to talk about. We'll do that definitely. Have them set up with me. I would love that.
Hang up here and come right on.
I don't really. It'd be so weird to be interviewed by you. So I'd be I'm like, that'd be very interesting. But we'll talk about health things. Whatever we'll talk about. I'm a life coach. Everything. I'm talking about anything you want.
Yeah. I know life coach thing sounds good, actually.
I am. I'm a certified life coach in 5 areas, so we can talk about that if you want to.
Perfect.
Something like that. So, everybody, Dr. Elliot Hirsch is practices in Sherman Oaks. Tell folks where they can find you guys online, because you're also on social media, all that good stuff.
So, our website is www.hirschplasticsurgery.com. Instagram is Hirsch Plastic Surgery. YouTube channel, you just Google my name, it'll pop up. And then the webcast, like you said, is Below the Surface.
Yes. And I'm JamesLott Jr. You're on A Lot of Hope with JamesLott Jr. A lot of hope. A lot of help. Also hope too. A lot of help with JamesLott Jr. And our podcast is everywhere streaming services are. The video is on JLJ Media. So you go ahead and go there and like, subscribe, and comment. And everyone, please stay safe and as sane as you can and wash your hands.